Hi everyone, my name is Shreya Mandava and I'm a PGY2 otolaryngology head and neck surgery resident and 2024 to 2025 Capello Fellow. I've had an excellent experience honing my advocacy skills with Doctors for America this past year. I'm excited to share a culmination of my work. First, I wanted to share a bit about my advocacy journey with you all, which has inevitably been shaped by my background and experiences growing up. I consider myself a Virginia native, and I've spent most of my life there. However, I actually moved around frequently as a child and lived in 4 different countries by the time I turned 8. I credit these experiences for planting a lot of early seeds, as my world was broadened at a young age and I developed an appreciation for the diversity of people, backgrounds, and perspectives. I became highly aware of the role that identity plays in how we live, are perceived, and interact with the world. I also became cognizant of the ways legislative processes directly impact us as my family went through the green card and immigration process ourselves. Flash forward to my undergraduate years, and I began advocating primarily for peer health through leadership roles on my campus. One of my proudest initiatives was enacting a once-a-semester free STI testing initiative for students, which continues through to this day. When I started medical school, I wanted to continue and expand my advocacy work to the population level. My mission was to fight for high-quality, equitable healthcare for all patients regardless of their identity. I became involved in multiple medical societies, including the American Medical Association and Medical Society of Virginia. I attended lobby days, served on boards, and wrote resolutions on a range of topics. Some of the most rewarding experiences were spearheading MSC's first policy supporting gender-affirming care and co-authoring an AMA resolution on pain control for long-acting contraception insertion. The topic subsequently gained significant media attention and prompted national discourse. Ultimately, it led to ACOG changing their guidelines this past May. Joining DFA and pursuing the Capello Fellowship felt like a natural next step as I moved into the next stage of my career as a surgical resident. I honed in on the access to affordable care impact area and joined the FDA task force within the organization. I've had an amazing experience serving in this group and expanded my knowledge on topics such as PDUFA and the drug and medical device safety process. I also engaged more broadly with DFA initiatives. I attended and moderated advocacy grand rounds and called congressional representatives to discuss topics like the importance of CDC website health information and Medicaid preservation. I also continued to engage in advocacy through organized medicine. I served in a leadership role in my specialty society, the American Academy of Otolaryngology Head and Neck Surgery, and urged our own members to engage with our advocacy work. I continued to attend AMA meetings and supported resolutions that tied directly into the work I was doing through DFA and the FDA task force. This past annual meeting was highly instrumental in pushing the AMA to be more vocal in fighting cuts to Medicare and Medicaid and attacks on science at a national level. I was proud to be one of the many voices in the House of Delegates advocating for this. As a Capello Fellow, my longitudinal advocacy focus was drug and medical shortages. Early on in residency, I had a jarring experience on an overnight call shift. There was a regional supply chain disruption that led to a shortage of CRRT, or kidney replacement fluid, in the ICU. As a result, my team was forced to ration remaining CRRT bags among patients we were caring for, based on medical need. I was shocked to discover how common shortages were at even incredibly well-resourced hospitals like mine. The FDA task force empowered me to pursue this topic. I presented on it to our task force and highlighted action items and policy solutions earlier in the year. I also worked on a Federal Register public comment on the Section 232 National Security Investigation into pharmaceuticals and ingredients as it pertains to shortages. Lastly, I had the incredible opportunity to lead a fly-in in Capitol Hill this summer with drug and medical shortages as the sole focus. We met with many Senate and House of Representative offices to discuss bills such as the MAPS and Rapid Reserve Act and speak broadly about the impact of shortages on patient care and their intersection with current FDA layoffs and impending trade policy changes. We hope to continue maintaining relationships with these offices going forward. Overall, I reflect on this past year as one of the most professionally rewarding of my life thus far. My goal ultimately is to deliver high-quality surgical care while influencing policy and legislation affecting my patients and the physician workforce. I want to thank DFA for helping me pursue my dreams of being a surgeon advocate, and I cannot wait to see where our joint efforts continue to lead. Thank you.